Okay, so what I'm going to do is I'm going to head over here to Medicare.gov. And the reason why is brokers like myself go there is because you can compare a lot of different plans and get some basic information about the plan. So what I did is I went over there, typed in a zip code, 89117, current coverage unknown. We don't know about the current subsidy, meaning financial and medication. So what I did is I already skipped through here and I went over to the Senior Care Plus, which you can see right there, which is an HMO. And here's their star ratings. Okay, and here's some of the numbers for the members and non-members. And when you go and click this, it takes you over to their website. Okay, and by the way, on Medicare.gov, it actually has the plan costs, which is right here, some of the benefits. But a lot of times it doesn't go over into more details, and that's why when you work with a broker, we're able to go over the details. But when you go over here, the Senior Care Plus's website, you can go to plans. We're going to go obviously to Southern Nevada, and then basically here's the provider directory. So let's stop here for a second. Besides cost, the second thing and most important part of healthcare is access to healthcare. So if you have a doctor that you want to keep, by all means try to keep your doctors. And this is the network they use called P3 Health Partners in Nevada, and they're growing, and they accept multiple different insurance companies as well into their network. So let's go back to Senior Care Plus. So we can go over here. Here's the formulary, out-of-network providers, low-income subsidy. I'm actually going to do a video on that, how to find it and what we do, where I can process it for you. But this is some of the information about the product. And then you go down to here. So as you can see, they list the doctors and hospitals, office visits, specialist visits, inpatient hospital, emergency room, which isn't bad, by the way. Emergency room is usually going up with most carriers. And then you hit over here, prescription drug coverage. Obviously, no one's looked up your medication, but these are what they have here for costs. And then the plan documents tab, if you want to go over here, look at summary of benefits, which is basically what we just did, you can click this. So I'm just curious, let's go ahead and benefits at a glance brochure and click this and see what it is. This is all for you. Okay, so they have the really nice little advertisement here. And again, here's their benefits. Clark and Nye counties, which I forgot to mention. It's also basically in Pahrump. And this is some of the benefits. So not too shabby. And just remember, when you look at any Medicare Advantage plan, Medicare itself doesn't care if you can hear, see, or chew, okay? Unless it's medically necessary. But a lot of the companies will add some basic dental, like this says, no dental, but preventive included. So what this does is it compares original Medicare versus their plan, which I think is pretty cool. So if you're looking at this from a consumer standpoint, you can actually see the differences. 20% and deductibles. Over here, it's whatever the number is, the copays, if there is a copay. So this is a really nice little, I wouldn't say spreadsheet, but advertisement piece. It kind of brings everything together. As always, before I leave, I always want to promote the use of a broker. The reason why is because brokers should have your interest at heart when they look through the plans versus a company rep. And they can look up your doctors, your medications, and see what plan or plans makes more sense to you. And obviously, there's different enrollment periods for different people. So if you have questions or concerns, you can call me or my office, and I'd be glad to answer questions or at least point you in the right direction. Thanks very much for watching this video today. Bye-bye now.